Local doctors, nurses, and other medical providers are joining White Coats for Black Lives. It's a national movement to support protests around the country and address health disparities.
News 8 Now's Mal Meyer explains how bias and racism can be found in the healthcare field and how they're trying to change it. New at 6.
The list of disparities in healthcare is wide-ranging.
From birth outcomes,
the risk of pregnancy-related deaths for Black women is 3 to 4 times higher than those of white women, according to the CDC.
to chronic diseases,
Studies show Black people are more likely to have hypertension or be obese.
to death from COVID-19.
Black people make up 25% of deaths from the disease in Wisconsin, but only 6.7% of the population.
It's important to start that discussion of why that is.
Dr. Caroline Wilker is the chair of the Diversity and Inclusion Committee at Mayo Clinic Health System. She says there's been conversations about the reasons why, but the disparities remain.
How to correct that is our responsibility as healthcare providers.
So they're taking a knee.
Like you, we are angry, frustrated, and saddened by ongoing prejudice, social injustices, and racism in our society.
They're taking time to reflect on how to improve.
Clearly, there's more work to be done.
Mayo Clinic Health System Regional Vice President Dr. Paul Mueller says the provider conducts training on bias and how to recognize it within healthcare settings.
That bias and prejudice can occur from our staff, but also can occur sometimes with patients where they have negative or biased attitudes towards our staff. And how do we handle those events when they occur?
And they're actively researching the disparities, educating themselves, and participating in community outreach.
We're here to acknowledge there's an issue that's very important, and we're here to listen.
So they can help all who walk through their doors, especially people of color. In La Crosse, Mal Meyer, News 8 Now.
And the White Coats for Black Lives movement did start in 2014.
It was organized by students back then after prosecutors did not charge officers in the deaths of Michael Brown and Eric Garner. Since then, thousands of medical professionals have joined in solidarity.